When asthma isn't well controlled using just inhaled steroids on their own, we add in something called a long acting bronchodilator. This is a treatment that works over 12 hours or 24 hours depending on the molecule and which particular device it is in. The names are formoterol, salmeterol and vilanterol. They're commonly added to inhaled corticosteroids to control asthma better. For example, they're very good if someone has exercise-induced asthma symptoms or if they are waking at night with asthma symptoms more than a couple of times a week. We then will consider changing the inhaler over to a combination inhaler that contains inhaled corticosteroid plus a long-acting reliever. So looking at the different inhalers that there are, the first one I'm going to show you, these are very common in the United Kingdom. You may well find in other countries there are alternatives, but the basic treatments are the same. So this one contains what we call beclometasone dipropionate. So beclometasone dipropionate is in fine molecules in this particular inhaler. So this is called Foster. It contains formoterol, so that's the long-acting bronchodilator that's with it. And the formoterol lasts 12 hours. So in other words, one dose is needed twice a day for the preventer side of the treatment. So the 100/6 dose is used one puff twice a day and contains the combination of inhaled steroid plus long-acting reliever. The way to use this is give it a shake, open the device, exhale fully first before you breathe in. This is true of all the dry powder devices. Exhale, breathe in, and then hold your breath for a count of 10, like this. And hold for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let the breath go. The breath hold is really important. Apart from breathing in quite fast and steadily through the mouthpiece, the breath hold is important because it allows absorption of the medication into all of the lung tissue. If there is no breath hold, then the treatment isn't absorbed correctly and therefore there is a less of a dose being absorbed. Close the device, and in the case of this particular treatment, this can be used as a reliever as well. So the formoterol long-acting reliever that's in this actually not only lasts 12 hours, but because it starts working after 2 to 3 minutes, it can be used as a reliever as well. It's licensed in that way. So in this particular device, this treatment called Foster, beclometasone dipropionate with formoterol is licensed to be used up to 8 doses in total in a 24-hour period. So that allows it to be taken once, twice a day, so that's 2 doses, plus 6 extra doses to control asthma symptoms. Now clearly your asthma action plan should state that if you are getting anywhere near 6 doses of Foster in the 24-hour period, you should really be seeking urgent medical advice to get an assessment as well, because your asthma clearly is not very well controlled. There's no time lag between doses either, so there isn't a recommendation to leave it half hour or an hour. You can actually use it straight away. If you've had one dose and then you feel 5 minutes later you're still tight-chested, coughing, wheezing, difficulty breathing, have another dose straight away. Okay, so it can be put in the pocket, carried with you, use it during the day if you need to. You don't need a separate blue reliever, salbutamol or Ventolin reliever, not needed. You just need this. It's an all-in-one treatment for this particular treatment called Foster. So that's one of the inhalers. In a device like this, but it's pink, so it's the same colour as that one. pink inhaler, pink and white, but that type of device called an aerosol. So you can have it either as a dry powder, which is better for the environment, it reduces the carbon footprint. But if you really don't like dry powder devices, or indeed if you're intolerant of them, someone who's lactose intolerant shouldn't really be prescribed a dry powder device. Dry powder inhalers contain lactose. So if you're intolerant of lactose, I would go for the aerosol, because that doesn't contain any lactose at all. This is a metered dose inhaler. If it's got Foster in it, the licence is the same in that you use it 1 dose morning, 1 dose at night, about 12 hours apart, and you can use it for relief as well. So anyone over the age of 18 can use it as a reliever too. This particular device is a dry powder. Remember, it contains lactose. If you're lactose intolerant, this one probably wouldn't be suitable for you. Otherwise, there's no reason why anyone can't use this. Probably the most common complaint I ever have about this is that in actual fact people can't taste it at all. Even though it's a powder, it's very fine, they're not sure they've taken it, but it doesn't mean their asthma isn't well controlled, it just means they can't taste it. So for this, you shake, take the lid off, dose counter here on the side, and in order to operate the device, you turn it forward and back, okay, till it clicks. Show you again, forward and back. That's now ready to go. Medication is in the mouthpiece, ready to be inhaled. Again, with all the dry powder devices, exhale fully first before you start breathing in. And hold the breath for a count of 10. If you feel that the dose 1 morning, 1 night isn't enough, you can use additional doses of this. Over the age of 12, this one is licensed to be used up to a maximum of 12 puffs in 24 hours. So do you remember the Foster was up to 8 puffs in 24 hours? This is 12. That's because in the Foster inhaler, the actual dose of the steroid is roughly 1.5 to twice as potent as in this one. This contains budesonide, this one is beclomethasone, dipropionate, extra fine particles. So because they're different molecules, different particle sizes, but mainly the medication is different and different strength. This one is only licensed up to 8 puffs in 24 hours. This one, 12 puffs in 24 hours. So that's Symbicort, comes in a turbo inhaler. Put the lid back on, again, just like the other inhaler, put it in the pocket, carry it with you during the day, and you can use it if you need to for relief of asthma symptoms. Duoresp Spiromax, which is another inhaler that has budesonide and formoterol in, made by a different company, and they've got this their particular product in an easy breathe device. Shake, drop the mouthpiece down, exhale fully, check you're not going to breathe in any foreign bodies in the mouthpiece, and breathe in. And hold the breath for a count of 10. Again, this contains the same treatment as the Foster and the formoterol, in as much that they have an inhaled steroid in, although they may be different molecules. Dose for dose, they're an equivalent inhaled steroid dose, and they contain formoterol, so it can be used as maintenance, morning and evening treatment, plus reliever if you need it for relief of asthma symptoms during the day or night. So they all carry the same licence. These two are licensed for maintenance and reliever therapy in the over 18s, and that's up to 8 puffs in 24 hours. This one, the licence for Symbicort, is for up to 12 puffs in 24-hour period. So that's the difference between them. There is also one other maintenance and reliever therapy inhaler called Fobumix in the Easyhaler device. So it's got Easyhaler written on the side. You'll remember this from some of the other videos, that you can have a separate long-acting reliever, short-acting reliever and separate inhaled steroids in this particular device. This one's got the combination of an inhaled steroid and a long-acting reliever. So again, it's got a dose counter on the side, goes red in the last 10 doses, so then you need to order a new device. Starts at 120 doses and counts down to 0. Shake, take the dust cap off, click 1 dose only, breathe out, I'm not going to inhale any foreign bodies, breathe in, and hold for a count of 10. This one, like the other ones, are licensed for up to 8 puffs in 24 hours. Side effects of any of these inhalers that contain either long-acting bronchodilators or side effects of short-acting and long-acting bronchodilators, whether they're combined with a steroid inhaler or not. Side effects are tremor, which often goes with use, but initially when you start using it can cause a fine tremor, can cause the heart to beat faster and feel like it's palpitating. And also some people feel just a little bit giddy and a little bit woozy. Should go with you, so for a few doses. If it doesn't, you may well need to go back to your prescriber, your physician, to get a different inhaler if those symptoms persist. One other inhaler is Steroid. So this one is just the inhaled steroid component called fluticasone. When it's combined with the long-acting reliever in their particular device, this Accuhaler, it's purple, 2-tone purple instead of two-tone orange. Used in exactly the same way as this particular device, in that give it a shake, open it once, slide open the lever, which opens the mouthpiece, breathe out, breathe in, and hold the breath for a count of 10. When you finish the dose, close it back up and put it on the side ready to be used again. Now this one is not licensed. When it's called Steroid, it is not licensed for use as a reliever as well. The reason being, the long-acting reliever in this particular device is called salmeterol. The maximum dose of salmeterol is already in the device. So 1 puff in the morning, 1 puff at night of these devices is the maximum amount of salmeterol you can have in a day. So you should not be doubling up or trebling up using 2 or 3 puffs twice a day. You have tremendous side effects quite likely, and actually it's too much salmeterol. So the maximum dose of salmeterol is 50 micrograms twice a day. 50 micrograms is in each dose, whether you have the 100 dose, the 250 dose, or the 500 microgram dose of Steroid. So Steroid is purple, remember. This is obviously orange, and it is just the inhaled steroid dose components. So it's just to show you the device itself comes in various different medications. So just remember, when you're on Steroid, it's 1 dose twice a day from this device. You can't have more than that. However, you are able to have 2 puffs twice a day of the equivalent Steroid in the spray, because the aerosol spray is half the dose of the fluticasone in this particular device. Their inhaled steroid in their dry powder device is twice the dose of the inhaler that's an aerosol. So the aerosol, you always have 2 puffs twice a day of the 50 microgram dose, or the 125 microgram dose, or the 250 microgram dose. 2 puffs gives you the equivalent of 1 of those, but they both contain the same treatment. Last but not least are the Relvar Ellipta devices. So again, a combination inhaler containing inhaled corticosteroid that lasts 24 hours and also a long-acting reliever that lasts 24 hours, and that's called Vilanterol. It comes in 2 doses. There's a dose that says 92 on it, which is the dose of steroid, so it's the 92/22, or there's a 184/22, so the 184 is the higher dose of inhaled steroid, and it comes in a device like this that is yellow coloured. Okay, so this particular company does a variety of inhalers. The one that contains inhaled steroid and Vilanterol is the yellow inhaler in 2 different doses. The most usual dose for asthma control is the 92. It's 1 dose once a day, and that is because both the molecules of the inhaled steroid and the Vilanterol, the long-acting reliever, last 24 hours, then start to wear off again. So you take it at the same time every day. Doesn't matter if you take it at night or in the morning, you choose, and then you just take it same time every day. If you need relief when you're using this inhaler, you can't use this one as you can Foster and Symbicort for a reliever. You have to use a separate blue inhaler, a reliever inhaler called either salbutamol, otherwise known as Ventolin or Salamol, or you have to use terbutaline, for example. The other name for that is Bricanyl. So it comes in a device like this. This is a placebo, a pretend one. It comes with a dose counter on the back. It counts down from 30 doses down to 0. So 1 dose a day gives you 1 month's supply in 1 device. The way to operate it, you open it, there's the mouthpiece. It's a dry powder, so you'll need to clean your teeth after you've used it. And again, it contains lactose. It's got a slightly sweet flavour, sweet taste. Remember, exhale fully before inhaling fully, like this. Put it to the mouth and suck it in. And hold for 1, 2, 3, 4, 5, all the way to 10, and then let the breath go. That allows the medication to be absorbed into the lung tissue. Close the mouthpiece, put it back next to your toothbrush or your teapot or your kettle, whatever you're going to do, once a day at the same time to remind you to take it. And we usually say have a drink, spill your mouth out with water, or clean teeth after you've used it. And that's it, that's done. You only need to use it once a day. Remember not to double up this because of the long-acting reliever that's in it. It's a maximum dose that's already in there. You can't have twice as much.